Hey there, health warriors! Have you ever faced a situation where a language barrier, cultural belief, or religious practice impacted patient care? As our world becomes more diverse, cultural competence is no longer optional, it's essential. Today we're breaking down why cultural awareness matters in healthcare, common barriers, and practical ways to improve patient-centered care. Let's dive in. Cultural competence means understanding, respecting, and responding to patients' cultural, linguistic, and religious backgrounds to provide personalized, effective care. It's about recognizing that healthcare is not one-size-fits-all. When patients feel heard and understood, they're more likely to trust their provider and follow treatment plans. What are some common cultural barriers in patient care? First, patients who don't speak the dominant language may struggle to understand diagnoses, treatment options, or medications. So, what's the solution? Use trained medical interpreters instead of relying on family members. Second, some patients may refuse certain treatments due to religious beliefs. For example, Jehovah's Witnesses rejecting blood transfusions. The solution here? Respect religious values while offering alternative treatment options that align with their beliefs. Third, in some cultures, mental health issues are stigmatized, leading to reluctance in seeking care. The solution? Approach sensitive topics with respect and cultural understanding while educating patients on available care options. Fourth, some patients prefer same-gender providers for exams and treatments. When possible, accommodate their preferences to increase comfort and trust. Recognizing and addressing these barriers leads to better patient satisfaction and improved health outcomes. Now, what are some best practices for culturally competent care? First, ask open-ended questions. Instead of assuming, ask, are there any cultural or religious beliefs that might affect your care? Second, use professional medical interpreters. Avoid using family members as translators. It can lead to errors and loss of privacy. Third, be aware of nonverbal communication. Eye contact, gestures, and personal space vary by culture. Adapt accordingly. Fourth, provide culturally appropriate health education. Use visual aids, simple language, and culturally relevant examples to explain conditions and treatments. Fifth, advocate for inclusive policies in healthcare. Ensure diverse representation in healthcare teams and training on cultural sensitivity. Small efforts in cultural awareness make a big impact on patient trust and care quality. Cultural competence isn't just a best practice, it's a necessity in modern healthcare. By breaking down language barriers, respecting diverse beliefs, and personalizing care, we create healthier communities and stronger patient-provider relationships. Have you ever faced a cultural barrier in healthcare, either as a provider or patient? Share your experience in the comments below. Like this video? Give it a thumbs up. Subscribe for more healthcare insights and patient-centered care tips. And remember, inclusive care, better health outcomes, stronger communities.